Hello, everyone. My name is Daniel Rivers. I'm the Partnerships Director here at AM Opportunities. Thanks for registering for this event. Hope you find the information helpful to your medical education and career. Whether you choose to use AM Opportunities to find your clinical experience, or you search it out on your own, or you use groups like study abroad exchanges or partnerships through your medical school. We hope that the information we present is helpful to you, and we are a resource for you. So with that said, I'll just turn it over. I'd like to introduce Dr. Lin. Maybe you can say a bit about yourself and dive into it.
Great. Well, great to see everyone virtually. Dan, Jeff, Happy New Year, and I hope everyone's start to the year is really wonderful. And I really enjoy these webinars that we've done over the last few years now, and really hoping to help people realize their goals and achieve their goals during the process. So thanks for everyone's being here, and I hope you enjoy the webinar, and lots of questions. Happy to answer as many as I can in the hour's time. And so my background, I'm a plastic surgeon in the Boston area, and I've been involved with AMO for a few years now. We've designed a lot of different opportunities, which I'm proud of, happy to have been a part of, and it's been really, I think, great in order to propel folks forward in terms of their path forward, and also with realizing whatever field that they want to go into. So I'm going to just share screen here and also my presentation here just to make sure. Can you see that okay? Hopefully.
Yep, it's coming up clear.
Wonderful. So I'm going to start by sort of kind of going through things and talking about, I just was editing this. This originally was a slide that was pandemic, but now hopefully we're getting past this, and I know it's still with us, but I'm taking a leap and just saying post-pandemic era, which is still relevant in all these things that we talk about. And so some of the things that are in my sort of world is that I perform surgery, take care of patients full time. I do have research teams, both nationally and internationally, internal and external, and medical students, residents, and postgraduate physicians. I teach medical students, residents, and fellows clinically and on site, and really some of these opportunities that became a real need for students and folks around the world clearly was no more than what you could see, but really became acute during the pandemic now several years ago. But all these have really continued in terms of the opportunities. The pandemic opened up opportunities to reach out and have people learn, and some of these opportunities did present themselves, and we've continued, which has been great. Telehealth, of course, so the internet, and it's an information highway with information widely available and accessible. So really great to be able to connect with people over time and abroad. And what I mean is over time, any time of the day, literally could be. And that's sometimes some of the challenges with actually arranging the coursework, is finding a common time. That's great when you have students from Europe, Asia, South America, really all over the place. And so obviously with telehealth, it saves on cost, travel, and effort. For me personally, it's allowed for ability to spend a lot more time with the students than an actual in-person rotation, to be quite honest, and it continues. Again, the letter of recommendation, LORs, and is earned like with any rotation, and it is possible with telehealth, I feel more readily than ever. And with specifically our virtual course rotation, it's really up to as many students as I think is feasible over a 4-week time period. It is a self-study course through the Scientific American platform that I help edit in terms of the plastic surgery virtual textbook and Scientific American Plastic Surgery through reading chapters, videos, daily assessments, and quiz on reading material. As related to daily lectures and meetings, we meet every day going over lectures and cases and answering questions and talking about all things, or maybe not all things, but many things related to plastic surgery in terms of the topics. In terms of the research rotation, this was now been offered for some time at this point, but it's really a 1-month course as well, based on the learning of the principles and basics of performing what's called a systematic review. It can be on a topic on any field, really, and the goal is to be able to put together a research paper for submission to a journal. And this project and this rotation is really the introduction for the basis of the paper that gets put together over the next period of months that we still continue to follow up with in terms of students, and to make sure they can get their papers to fruition and be able to submit to a meeting or to a journal. And it's a very systematic process, and it really is spells out all the steps that need to be done, and it's very applicable to a topic in any field and any topic. And so it's not specifically only related to plastic surgery, but it can certainly be applied to whatever interests that folks have in terms of the fields that they want to go in, whether it be neurology, internal medicine, anesthesiology. All these topics have any field have lots of literature, but really honing in of what the topic is to make sure that the topic is doable, and we help during the process, both during the month, of course, again, and afterwards as well. And this is one of the course slides that I hand out to people. It really is a stepwise process. This might look a little daunting right now, of course, but it's really broken down by a stepwise process, and it's very doable, very manageable, especially through a remote type of setting as well. So that's been a really great addition to the courses that we've had, that I've had with AMO. And just a brief word on my colleagues who have been able to help with the match process through IMG Match. And this has been also a global outreach group that is really centered on helping people match within the US. As you know, several thousands of people apply from all over the world, including the US, and there are match rates that are available, publicly available, and it is possible. But with different factors being important in terms of the match cycle, it can be also very daunting. And this is a group to really bring all that together in terms of coaching, mentoring, understanding how the rotations work, visa situations in the US when people want to try to apply. I think it's really the only residency program for coaching mentoring group created for international medical graduates, and that's been created by international medical graduates who have really walked the walk, and so they are very, very knowledgeable about the entire process and being able to teach and help people through the process. That you can look at the site regarding the different services that are available, really from soup to nuts, from personal editing to all the way from that to interview prep and residency mentor packages, and really being able to match people together to in their field of choice, to be able to offer them information and help guide them along the way of the match process. And AM Opportunities has been a wonderful partner in this in our project with my colleagues in IMG Match, and we look forward to really helping people in the match process and also beyond. The new challenges that we know of currently, for instance, is that step one, which has been is always on a lot of people's minds. Step one is now pass fail as of last January, certainly. And so the one thing that I think one of many factors, which I think was able to really have people distinguish themselves from a testing situation, of course, is now pass fail. And so even more so that everything else is more important in terms of distinguishing yourself for residency applications. And honestly, observerships are starting to open up here and there, but they're definitely not fully open, and hard to say when they will be, because I know from visiting institutions and talking to colleagues, it's just not the same now. Post-pandemic, certain things are not the same, and so, for instance, this interview cycle again for this year is completely virtual again for 22-23. So the hybrid situations and virtual platforms will continue, and hence the virtual learning cycle and telehealth and virtual learning is definitely here to stay. So really, I would say take advantage of all the things that AMO Opportunities has for you. There's a lot out there, and they've built really a wonderful network of clinicians who can help. And so that's really what I had for some comments, and happy to hear questions and help.
I'll ask a few questions and then we'll kind of go through the Q&A section. But you've mentioned before that, because there's US medical students and graduates here, there are medical students and graduates probably from all corners of the world tuning into this webinar. You've mentioned that even your students at Harvard, local students might be in Boston, and they're even doing telehealth rotations or research virtually, maybe meeting with you virtually. Just wanted to make sure everyone's aware that it's not just an option for sort of somebody in India or around the world. This is even in the US, medical schools are still having classes virtually. Many schools have developed curriculum around telehealth, and that will be even more and more. It's just so common here. I think every doctor's appointment I've ever had in the last 3 years has been virtual. So maybe you can talk about how, what's the difference? Is it, if a student's right down the street in Boston, why can't they just come meet you? What's the benefit of the virtual platform for even local students?
Sure. No, thanks for that question, Dan. And certainly telehealth options, virtual options continue to be absolutely present, and they will definitely not change. I can give you an example of our own sort of conferences among colleagues where beforehand everything was in person. So clearly you can see what the status of the work world balance is these days, with everyone working from as much as they can do virtually is now the case, where workers and employees are really just demanding to be able to have virtual hybrid options or hybrid work week, so that they're not in person all the time. Obviously, there are occupations that require in-person attendance, because it just wouldn't happen. Obviously, clinical medicine being one of those. But I would say that even our educational conferences are hybrid. They will remain hybrid. And it's just obviously a lot easier for folks, even in the same city, to log on and participate. And that goes the same thing with students who, even though they might be in the same zip code, hopping on a call and contributing and actively participating are things that are here to stay, and are definitely options, definitely time savers. And for those folks who certainly are coming from overseas, a great opportunity to interact with people.
And we touched upon the changes, or you touched upon the changes in the residency match. Step 1, moving to pass fail. Step 2, CS was canceled. I think that was almost 2 years now. There was even talk in the woodwork that step 3 might go to pass fail at some point. Regardless if that happens, it's become a little bit more holistic. And part of that is an increase in the importance of those letters of recommendation. So I know you touched upon this. Do you feel you can write the same quality letter for someone who does a virtual rotation as in person? I think a lot of people still are under the assumption that virtual is secondary. If I can get in person, that's primary. But we know that many programs are not in person. Many doctors, preceptors are only holding virtual rotations, virtual research. So, what's your feeling about the quality of that letter versus what you wrote maybe 3 years ago when everything was in person?
Sure. Yeah. So they are different. They're different objectives or things that are, I think, accomplished with the status or the sort of the format of the rotation. So I think from a virtual standpoint, at least from my personal experience or my rotations, they are primarily very didactic, and there's lots of a broad informational sort of transfer in terms of different topics that we go over for the course of the month. And obviously, like I just said before, a lot of more FaceTime dedicated time that I'm interacting with the students for sure. From the clinical in-person standpoint, that really is I think the objective of seeing what the hospital, like for instance, what our hospital is like, interacting with people in person and seeing what they're like, and seeing how the hospital runs, seeing how our service runs. And it really just depends on what you want to try to get out of these two different options, rotations wise, because like I said, also that if even the inpatient or in-person rotations that we have, that hospitals have traditionally had, the level of interaction that I personally have with that student who's coming on rotation is actually a lot less than I have with virtual students, because you're being exposed to a whole array or a whole service that is our service. That is, so lots of people that people interact with, the trainees, the residents. So my sort of day-to-day personal interaction is a lot less than virtual. So in a way, for me at least, probably would know them a little less because I don't see them as often, for sure. So that's important and strong. I mean, there is a plus and minus, I think, with both of them, honestly. So it's still a limited amount of time to try to get to know people, certainly. So it's I understand the dynamic of trying to get as much sort of face time and exposure and demonstrating your work ethic and everything. So certainly we would have to speak to both of those aspects, but there are ways of earning an LOR both virtually and in person, and they differ. Some obviously they're similar in different ways, but of course different in others. But I would say the didactic is a lot different. The letters I write for both really speak to the amount of interaction that I have with folks. So it's the important thing is that you have an interaction, and you're able to have venues to interact with people regardless of having an in-person rotation option or not. You can still interact with them. So fully want to take advantage. I would fully suggest people to really take advantage of those things.
All right, I will ask 2 more questions and then we'll go to the audience questions. I think, in my opinion, one of the factors, there's 44 factors that they write that, residency directors look for as their ranking candidates. But one is, consistency. And after you graduate, what are you doing to stay clinically, medically relevant and not really having any breaks? I think a lot of, at least early in the pandemic, a lot of people didn't take advantage of that. They were kind of waiting. Oh, it's COVID. I can't do the things that I had planned on doing at this time. Anything you want to say about that? I mean, I know virtual options are always there now, so
Right.
you can kind of continue to stay updated. And a second part of that question is, people think, virtual for surgery or for, I don't know, I could go through all the specialties, but, we have about 50 different specialties being offered virtually through our preceptors. And a lot of people think, how could those specialties be virtual? I understand sort of family medicine appointments are through telehealth. I can meet with the doctor, review any diagnostics, and kind of learn as I'm watching that doctor-patient interaction. But in different specialties, plastic surgery, how can you learn virtually? And when they come in person, are they actually doing any plastic surgery, even if it's considered a hands-on rotation? How much is it hands-on? And could you talk about that? So kind of a two-part question.
Yeah, and so I can say that the continual learning process, I think in medicine is really the case when you go to medical school. I think that's one of the lessons that when you go to medical school anywhere in the world, I think that is certainly impressed upon people, that it is a continuous learning environment, that it's a lifelong learning experience. So you're never stagnant in your learning process. So I'll say that it's interesting. I've even had practicing surgeons who want to learn updated things, have taken the course, and they've been in practice for many years. So it comes full circle when you have all levels of people interested in taking courses that are offered, and from medical school all the way through training and beyond into practice. And so that's absolutely key. In terms of, again, more nuanced things in terms of learning and how to what can be conveyed in our field, just specifically with plastic surgery, it's a very visual field, of course. That you're just looking at what you're doing in terms of what you're affecting. If it's a reconstruction of a cleft lip patient and the child, or if it's something more involved, it's such as a larger breast reconstruction case, or head and neck reconstruction case, or hand surgery. It's very visual, so you see it, and then once you see it, you really do, I think, learn it and understand some of the aspects. Begin to, at least. It's only a month-long sort of immersion into the topic, of course, but for the material that I share, it's definitely a stepwise project that has a schedule involved and themes of every week, daily themes of the topics that we go through, and it's organized as such so that it's a number of hours during the day, and of course we spend time in the evening. And the research rotation, a little different. It's more independent study, because it's about everyone's diverse interests and formulating an idea, a research idea that's feasible, that's doable, that we go through each week specifically in order to really make sure that people are on the right track. And then once the month is done, we continue to follow up with them even after the month.
All right, my last question, and then I see 43 questions now from the audience, so we'll go to those. My last question, let me just share my screen one more time, is really around research. So, as we mentioned, all the changes with the residency match and what residency directors are looking for, recent statistics say that 41% of residency directors consider research, but that is sort of specialty dependent, and then 30% when deciding who to rank. Any thoughts about this? Are you looking at what research they've done? How important is that to you? And any advice you can give? Does the research have to be done in the United States? Like, for example, if it's a U.S. medical student and they're working with guys in St. Thomas in London and they get a published paper in London, is that considered? If it's, I don't know, a medical student studying in Prague, for example, and they get published research in the specialty they're trying to match into in the United States, but that research is published in Czech. What are your thoughts around those topics?
Yeah, no, that's great. The research is definitely very important, and I would say, and the field that you have listed here, but really in a lot of different fields, and with sort of this step one sort of process that's taken its course, step two, perhaps step three, is just a progression of things. Everything else becomes just more important. So the more effort that you can spend towards demonstrating an interest in the field, clearly that's something that that I think hopefully is more in your control. It's not obviously determined in one day either, like an exam, but it can be cultivated and worked out over a time period to submit papers and get them accepted. Really does demonstrate interest and dedication, I feel. And certainly if you had two equal candidates with both a pass on their step one score, one candidate with 10 research papers and another one with one, I think you would have to say that with the degree of some certainty that the person with some research might have a little more traction on their CV just with the level of effort that they've put forth. And what I would also say is certainly research being performed in other parts of the world with your mentors is perfectly acceptable. And there are lots of different types of journals, international journals that are available. And it's really more the idea, the conclusions, what you took away from it in terms of the process that I think is really great to be able to talk about during the interview process.
And one more thing I thought about is kind of networking, and I kind of have brought this up a lot lately because people think about networking in business and economics, but I feel part of it is really becoming known and making friends with the doctors that you're working with, your preceptors in the United States. Maybe they're not going to apply to a residency with that doctor, but maybe that doctor can give them ideas and tips through the process. So I don't know if that's so much of a question, but I just want to express to all of you that whether you utilize the AMO network or VLSO or some other connection you have to get clinical experience, or your school organizes that for you, for US medical students, of course, really think about developing those relationships during the program, whether it's a virtual research, in-person hands-on rotation at an ACGME teaching hospital, or just a private practice. Doctors have connections. They don't necessarily have to have those academic and hospital affiliations. They all went through medical school. They all became doctors. And so really building that relationship. But I wanted to say that, but I don't know if you want to elaborate.
Yeah, no. I mean, clearly, telehealth has opened up a lot of opportunities for collaboration and meeting people, networking. All those things are so true. And when you learn and take care of patients, as you continue to meet more people and meet more patients that you take care of, they're all interesting, of course. It gives you a lot more of a deeper perspective into folks and being able to connect with your patients. I think that's really a true thing beyond the aspect of getting together a research project and seeing it through completion, but really learning about different parts of the world and different. You learn things all the time, really. So it's just that human nature touch of the fact that we each have a lot to teach each other.
All right, I'm going to just go through the questions. We will not be able to get to all of them. We'll do Q&A for about 15 minutes, and then I will stop recording and unmute all of you. Hopefully I can unmute everybody and you can just ask questions directly. Could you go over the general requirements to be accepted into a residency program? That question is a difficult one because it's different for every specialty and every applicant. And your pathway to residency is probably going to look very different from the person sitting right next to you trying to get into the same specialty. Everyone goes through a different process, but I don't know if you want to just talk about the most general requirements.
Yeah, sure. So, you have to be enrolled in a accredited medical school. You've got the letters of recommendation that you'll have to put together. They'll have to submit on time. You have your training exams for step 1, 2. At this stage for residency, you have your own grades from medical school that you want to make sure that they're as good as they can be. And of course, with the application process, there's ample opportunity to share more about yourself, your hobbies, your research, different. But it's not just one thing. It's a lot of different factors that programs will be looking for.
And I'd like to add that, we have about 300,000 medical students, graduates at any one time using the AMO platform to secure their US clinical experiences. And I have to tell you, over the last few years, we've seen more and more even first and second year medical students doing sort of virtual rotations in the US, at least not US medical students, but foreign medical students. And the reason for that really is to get ahead of their classmates and show a timeline so that when, 5, 6, 7 years later, when you apply for the residency match, you can show a timeline that you started early, you developed, you figured out what specialty you want to go into. So that's just something I've noticed. We didn't really have first and second year medical students participating, but really our programs are open to, as long as you're at an accredited medical school. And some of you might have the question, well, what about the ECFMG changes? Not for the US medical students, but for any foreign medical students that are here at this webinar. We're actually holding a separate webinar around that. I know there's a lot of concerns over those changes and is my school going to be accredited and different things like that. So that's kind of a separate conversation. How important are STEP scores? Well, step 1, if you still have a score, I guess you could talk about that, Dr. Lin. And then what if step 1's pass fail? How important is step 2 CK right now?
Right. Well, if you have a numerical number and you've done well, great. That you should definitely bring that up and promote that as best you can. For most people now, a lot of people now trailing after January of last year, where it's pass fail. Everything is equalized, equal playing field. Step 2 is fine. As a number that I would think that. My personal thought is it's not directly correlated very well with step 1, and most people generally do the same or better on step 2 than their step 1. That's just a generality. Not applies to everyone, but that's generally what happens. So it doesn't correlate very well. And who knows, might be pass fail by next year or 2. We'll have to see. So, but again, like I was saying, everything else is more important. So you want to make sure your application, your letter writers, your research is as robust as it can be, because everything is more important now that step 1 is pass fail.
The second part of that person's question was, how long should clinical experience be? From our perspective at AMO, we built all or most of our programs to be 4-week blocks, and we work with our preceptors to do that in 4-week blocks. A lot of schools, medical schools in the US, have 4-week blocks for rotations, sometimes 6 weeks. But I wouldn't say do less than that, just because in 2 weeks, for example, it's very hard to develop a relationship with the preceptor. Most preceptors are not willing to write a letter of recommendation if they've only known you 2 weeks. Sometimes it's possible, but you really can't dive into the subject matter. Maybe Dr. Lin, you could talk about how many of your past visitors that enrolled either into your virtual research or your plastic surgery rotation ended up extending. Was that important, or did they get everything that they kind of needed in that 4 weeks?
Oh yeah, exactly. So for the most part, I would say it's been a minority of people who are extended rotations. or taken another course. But there have been several people who've taken both virtual and the research components that I offer. So it does definitely depend on the person, and but it's I think with both of them, either one, it's a month-long experience or course. So I feel like I certainly can interact with the people pretty well. And but yeah, there are the people that definitely have taken multiple months.
Any tips for getting into residency after USMLE step 2 and step 3 are done? Well,
yeah,
more clinical experience. I don't know.
More
what
clinical
do you say?
experience in research. It doesn't get easier, of course. So unfortunately, but that should hopefully not deter you if you want to. If your goal is to train in the U.S., there are resources, people willing to help and help you through the process. It is a stepwise process. It doesn't oftentimes happen over a year or two, but would plan on sort of a multi-year type of approach to it. And it is, I always encourage people, like you were saying, Dan, that to get started really early in the process, if you can, if you know, and you can. For instance, those first and second year students who are already thinking about these virtual rotations and getting exposures, I think a great thing, because things take time.
The next question was, how do I get research? And so I posted in there, you can get them through AM Opportunities. We host Dr. Lynn's programs. We host other research programs. I'll send a summary email with links to those programs. We also have J1 one-year programs. So AM Opportunities is just one resource. It is very time consuming to apply directly. A lot of doctors in the United States actually don't respond to those emails. They're busy, and there's a lot of requirements to get into these programs, and I think that's where our mission is to create access for U.S. medical students and medical students and graduates around the world, and we do that through kind of taking away that administrative burden of the doctors, especially for the in-person programs, all your immunizations, visa, flights, housing. For US medical students, it can be the same: housing, flights, the logistics, right? So that's where it gets tricky. Some people email thousands of doctors across the US trying to get someone who will respond to their email and work with them. Applying through AM Opportunities, you have guaranteed access. The spots are available, and you just kind of pay and reserve. The time-consuming aspect, if you have the time, sure. Any thoughts, Dr. Lynn?
Specifically on the application process?
Yeah, how to get research. I mean, I don't know what else I could say besides offering our services, but it's
Yes.
yeah.
Yep. No, I would look at the site and the opportunity and the course descriptions for sure. I think it's pretty straightforward in terms of the research, at least in terms of the process of what it is that is what I just described in our research rotation, which is the mechanics of a systematic review, which is very doable, and we've been doing it for a while now. But in terms of other research projects and clinical patient sort of related data at your home institutions, I would definitely encourage folks to reach out to their mentors locally, wherever they might be, and see if they have research opportunities, and try to begin those efforts, because it does take time, and it's not going to happen over a month or so. It takes several months, even longer.
What advantages do U.S. medical students have over international medical students? In my opinion, they do all their clinicals in the U.S. So it's about making those connections. They're meeting maybe 100 preceptors throughout their couple of years of clinicals that they're doing. They have multiple people they could ask for an LOR, whoever they think will write the best one, and they really can get that advice. And so that's kind of the leg up. The question was, what if I want to match into a very competitive specialty and I'm an IMG? What can I do to kind of increase my chances?
Yeah, so I would start with, getting a broad knowledge base, really doing well in your medical school, your grades, obviously taking the tests and making sure you prepare really well for those tests, do well. Of course, now it's been, I think, double-edged in that it is pass fail, step one, that is. So I think that bar has changed. So again, everything else is much, much more important. But clearly, if at the end of the day, if it's a goal that someone wants to try to match in the US, then you will need to start getting to know folks in the US so they can support your application. I don't think there's any way about that. It's just going to be whatever field that you are interested in, and trying to establish some ties with people in this country who are in that field. And the AM Opportunities definitely has a whole wide range of preceptors, mentors in all the fields.
The next question is really around somebody who doesn't want to become a doctor, but wants to, maybe get into data analysis in the health area. This webinar is really about clinical experience that leads to, or research that leads to matching for residency when you apply through the ERAS system. If you're interested in data analysis, biotechnology is kind of the next kind of nearest field. I think we have one biotechnology one-year program available through our website. You can look into it or ask one of our advisors. Is it necessary or perceived better to do research in the US? This comes back to my former question of, so maybe you could elaborate. I think we've already answered it, but if you want to.
I mean, again, I think if you want to train in the US, I think having some US experience with preceptors is going to only help. I think you should work hard and do a good job, of course. So not by only having a contact or a research project, but you obviously want to do a good job at it. So might weigh a little bit differently than doing a research project from your home country, unless it's something that is really, really well worth it, and a special project that I think that would gain some notoriety. But there's lots of opportunities in the US virtually through AMO, or just sort of on site as well. So I think I can just try to tell you that it takes time. It can be a multi-year process. It doesn't happen overnight. So I would just be prepared for that.
The last question that I just kind of answered is, let me go back to it because I clicked it off. Now I lost it. Okay. All right, at this time, I'm going to stop recording. I hope you found this helpful. What I'm going to do is I will start unmuting everyone, but there's a lot of people here. Claire and Jeff are here in the chat. They are both advisors. They're very familiar with Dr. Lin's programs and other research programs. They're going to be going through the Q&A section and answering any questions that they feel very comfortable answering. That way we can kind of twiddle those questions down to just the ones that maybe Dr. Lin and I need to address. So thank you for attending, but please stay on. I will allow you to speak directly if you like, and we'll kind of continue on with the questions. Thank you all for your time.